Hi, everyone in our community of Lindsay, and thank you for joining us this evening. And the biggest thanks of all for everything that you're doing in our community to get vaccinated, to keep each other safe, and to be doing what's asked when it comes to the health orders. It's been such a tough time for our families, for our small businesses, and as I know, as a mum of three, for our school children, and we all can't wait to get out of this lockdown. So thank you for being here tonight. I've got a really special local guest with me to answer your questions, Dr. Nguyen of Nepean Hospital. And thank you very much for being here, Dr. Nguyen. Dr. Nguyen is one of our leading doctors. She is on the front line of intensive care in Nepean Hospital. And from my conversations with her about what's going on in our community, the state of play when it comes to COVID and our hospital, I really wanted to give our community the opportunity to hear from her directly as well. It is truly some inspirational work that's going on in our hospital with both our doctors and our nurses to keep people safe and to look after people who are sick with COVID. Before we go to Dr. Nguyen, I just wanted to quickly read a couple of messages from the community, Dr. Nguyen. I think this is important for you to hear because you can take these back to the frontline staff. We've got Jody from South Penrith who has said, I just wanted to say thank you to all the staff at Nepean Hospital for always going above and beyond for our community. And Kim from Jordan Springs says, I have no questions, just to say I trust Dr. Nguyen and say thank you. I know that there'll be more of this sentiment from many more people across our community. I've received a lot of it on Facebook already. So some good news for our community. We've hit those 20 million doses across Australia, and we truly have played a part. We are up to, I think the last count, the official count was 67% of first doses last week, and we would have hit 70% now. So thank you so very much for everything you are doing in our community. And we've hit the 7 million mark in New South Wales at that 70%. You're doing really, really fantastic work. So now to who you're here to listen to tonight, to Dr. Lee Nguyen, and I'm delighted to be joined by her. She's a senior staff specialist in intensive care at Nepean Hospital, and she's a true local. She lives here in Penrith, and she's been at Nepean Hospital for about 20 years. So she does know our community, and she's looked after so many of us, and she is on the front line, as I said, in Nepean Hospital in intensive care. And she's also a clinical advisor for the state response to COVID. So she's playing a really important role for our state when it comes to the intensive care response to COVID. So Dr. Nguyen, thank you for joining us. As I said, you are on the front line of COVID in our local community. I thought we'd start if you give a bit of a lay about your role and a bit of a lay of the land of how we're going out there in our community and the local Nepean Hospital's response.
Yeah, thanks, Melissa, and thanks for inviting me this evening. I'd echo your sort of sentiments in regards to how well the community has rallied through really difficult times to really sort of rise to that challenge of getting us vaccinated, because we all appreciate how difficult it is for everybody at the moment. Those online, and you'll be aware that Nepean Hospital has always been a hospital that's sort of under strain and plays out in the media, and as a result of that, we've got this beautiful hospital that's being built at the moment. So we're used to being able to rally and rise to the challenges, and I think that's that's really a reflective of our wonderful staff. You understand, I mean, I think it's certainly played out in the media, and is understanding that that a lot of the COVID activity or the COVID burden in hospitals is in our western suburbs, so spread between Nepean, Liverpool and Westmead and Blacktown areas. So for Nepean Hospital, we've certainly seen an overwhelming number of patients in the last sort of 4 weeks or so. And it's a rapidly changing sort of environment where our staff have really needed to pivot and change the way they do things in order to really serve the community. So we have at the moment, over 100 patients on the ward who have been, who are COVID positive. There are patients in the intensive care, and we've certainly expanded the intensive care. So although I'm an intensive care specialist, I really sort of have a sense of what it's like on the wards for the doctors and nurses at the moment, as I see the numbers get reported. Our EDs remain busy, although we don't have as many patients coming through, but everyone can understand the challenges of streaming patients and making sure that we sort of cohort patients who may have COVID known from the community, those who we suspect to have COVID, and all those who come in who are sick for something unrelated to COVID. So that adds this extra layer of coordination, and I'm really proud to be part of a community that, like a health community, both at Nepean and also across the state, where everyone's really working hard to do the jobs that we've been trained to do.
Yeah, and I would like to, you're talking about the job that you're doing in the hospital in intensive care, and I think something that really sort of resonated with a lot of people in the community was that impassioned plea that you made. You said that 25% of people with COVID in intensive care were under the age of 40. So I just wanted to get a bit of insight into why you've made that plea, and I guess the importance of your message.
Yeah, look, thank you. And I attended the press conference with the Premier a couple of weeks ago, and yes, I stood there to sort of represent intensive care community across New South Wales. We've been seeing the rising numbers, and as everyone will know, everyone sort of tunes in at 11 o'clock every day to sort of get a feel for what the numbers are. And what has really worried us is the increasing so not only COVID patients, but positive patients in the intensive care in the hospitals, but how young, and the young group. Now, we know that that's really a reflection of the fact that that we had limited supply of vaccines, and we prioritised through successively from last year when it became available, and the younger population was really a reflection of those who are unvaccinated, and also those who are more mobile. And genuinely, I think through the lockdown, the patients who were seeing who came out positive with COVID were going about doing essential work. So that's one part of the equation, that the availability of vaccine, and also a degree of reluctance from the community to get vaccinated. And it's normal, it's natural that when you don't see it around, and that was where we were. We had a bit of a blip in December with the Avalon and Northern Beaches cluster, but then we had we'd sort of had a time where there was very little COVID. And because of that, we probably didn't ramp up vaccinations. There was not an uptake as much, and there was a lot of uncertainty in the community. And I think that was the culmination of those things led to the increasing numbers. So the 25% less than 40, I think it's really striking, because these aren't patients who have comorbidities, or they're unwell previously. They're really previously really well, plumbers and tradies, and your everyday people. So to see them get infected, and I think that the other thing that's been really worrying for us is the transmission that we've seen with Delta. So what we were seeing with the wave of the alpha wave last year was that if a family member was positive, they may have a transmission of about 30% to their family unit. But what we were seeing with Delta was essentially 100% transmission and very early transmission. So it was really difficult to catch that isolation period in order to, prevent them spreading it to their families.
And you're seeing whole families come into the hospital then with that?
Yes, so I wasn't involved in this particular local family, but I'm aware of a family unit, in a 4-bedded area in the ward, because that was the best way to care for them. You would have heard, there are stories of patients who, husbands in one hospital, wives in another, grandparents or mum and dad in another one again, and we're increasingly seeing families where, because both parents are unwell with COVID or admitted to hospital, and they haven't been able to find other alternative sort of appropriate care for children, they're being admitted or cared for as part of the children's network as well. So there's lots of stories like this of not only challenging times from the point of view of having COVID, but the social impacts of it.
Thank you. I could keep asking you questions for the rest of the evening, but we have so many questions from our community. And if you do have a question, I encourage you to also put it in the comment section on my Facebook page, and we'll endeavour to get to as many as we can tonight. We've had some people in the community submit some questions already, and I wanted to start asking you some of these, Nia. And the first is Dorothy from Cranebrook, and she says, is our local area in a good place compared to others in New South Wales? We have an amazing hospital, but will it handle sudden increased infection numbers as we start to open up socially when we've achieved that 70% double dose vaccination?
So we are so fortunate to live in a city and a state with a really coordinated health system. So part of my role with the Ministry of Health in the COVID response is really trying to coordinate a whole of health response across all the city. At the moment, there is a concentration of pressures on the hospitals in the West, but we have plans in place to either move patients or move staffing in order to help. So is the system under strain? Yes. Do I have confidence that we have mitigation strategies or ways to support the staff and patients to ensure that we provide the best care we can? I have confidence that we can do that. There'll be no doubt there'll be bumps in the road, and there may be frustrations in regards to having to be transferred across the city because there's less there's certain pressures at the point in time that particular patient came to Nepean, but I think the community should have confidence that when those decisions are made, it's in the best interest of the ability for the system and the nurses and doctors to provide the best care they can for the patients they have. In relation to opening up, we know that it's likely that there will be a bit of, potentially a bit of a surge, and in light of that, I think with that expectation, we're geared for it. What we do know and we believe will occur is that with 70% vaccination rate, and as that number increases, you may find people will get COVID, but their disease or their infection will be milder, and more of the community being vaccinated will then mean they're less likely to transmit to others. So all those sort of strategies helps to helps to sort of allow the system a bit of time to prepare, and it builds on the preparations we've done from March of last year.
Thank you for that. And I know that a number of people submitted questions of that similar nature, wanting to know about, and you said this to me previously also about ensuring people still do seek medical attention when they need to for other things, and not to be scared of doing that.
Yeah, so I think that's a really important thing that we really like to stress to the community, is that we have the systems in place to stream. It's not going to be 100%, but we do our best in regards to knowing whether which patients have COVID and which don't. And it's so crucial that if you have problems like chest pain or other problems that you would normally go to see a doctor, to really still seek the help that you need, because that reluctance to seek care, whether that's through your GP or through the hospital system, may have significant consequences.
Thank you. I've now got a question from Julie, who is in Emu Heights, and she says, could you please tell us the patients in hospital, what are the numbers of unvaccinated compared to vaccinated? I guess this would be in regards to having COVID.
Yes, so of the patients in intensive care, you would have heard the vast majority. I don't at the moment, at Nepean Hospital, there's sort of around the order of about 13 or 14 patients in intensive care at the moment. I don't have the exact details about how many of those are vaccinated, but I know in the reports across the state that I receive, the vast majority are unvaccinated or have only had one dose of vaccine. There is, don't have the information about the 120 patients or so admitted to the ward, but the experience across the state, and you would have, the community would have heard Kerry Chant talk to this, is that the vast majority of them, so overwhelmingly, those who are coming to hospital with severe form or needing, those who are coming to hospital with COVID who requires hospitalisation or intensive care admission, are broadly speaking, the vast majority are unvaccinated.
Thank you. And now to a question, and I won't say a specific name because it's been sent to me by a number of people in our community, and it's around, a majority being parents, around the vaccinations of our children aged 12 to 15 years. And obviously parents are concerned at this time. We all want our kids to be able to go back to school. Why is it so important to have this age group included in the vaccination rollout?
I might just start broadly speaking about how important vaccinations are, and then go to this particular group. We know that vaccinations decreases the severity of disease and decreases your risk of death, and the availability of vaccines. We've sort of went through all the priority groups according to the sort of national plan. Now, with the availability of further vaccine supply, through a really sort of quite rigid, and I'd be comfortable to say it is actually a really rigid approval process, and gathering of the data through a group called ATAGI, and that's sort of a national advisory group which provides advice about vaccines, and also the TGA, which is sort of our governing body to talk through all the medicines that we get, with the approval from those two to recommend the availability of Pfizer to the 12, 15-year-olds. I would take comfort in the fact that this is based on science and the evidence overseas. It's, development of vaccines. Everyone's worried that the development of vaccines have occurred so quickly, but we've, in modern day, we've never had this sort of cohort of patients that we could give a vaccine to, and we could monitor and look for adverse outcomes or adverse reactions. So I think overall, absolutely that with the ATAGI and the TGA approval, it is safe. Now, to answer your question about why 12 and 15-year-olds, I think it's part of the whole strategy to make sure that all our community who could have it from a scientific and evidence point of view and a medicines point of view who are eligible for it should. And we do know that children or adolescents tend not to get as a severe disease when they do get COVID. So you might sort of say as a parent, well, if they're not going to be that sick and it's just a sniffly nose, why bother? But in fact, it's really about the impact on the whole community as well, because it still remains, even if it's a mild disease, it still remains very infective. So that the protection in the 12 and 15-year-old is just as much about themselves as their family members. And the other thing is that we know that there are a lot of patients who may have underlying medical conditions, so chronic health conditions which make them more vulnerable and susceptible to other diseases, and we know then that it may make an existing condition worse, or alternatively, your pre-existing chronic disease may make COVID worse. So all in all, this is really part of a whole strategy to minimise the impact of and reduce either your risk of getting COVID, but if you do get COVID, then it's the mildest possible form that you can get.
Thank you. I'm just going to jump to a question that's come through on Facebook just now. Rita asks, is AstraZeneca stronger than Pfizer, or are they both the same effectively? Are they going to both protect us equally?
So this is obviously played out a lot in the media, and we play it's the number of, like, in relation to going to down to the statistics and percentages, and I always sort of talk to the fact that overall, so if someone quotes to you 90% or 95%, as an individual, that's from a population point of view, but as an individual, it's probably still, there's this 5% that, you might be the sort of unlucky one, for instance. So, are they both, with both doses of Pfizer and AstraZeneca, once you've had your 2 doses, they give equivalent cover. And I think that's the most important message. And I think that the confusion, I suppose, in the last sort of, up before we had this surge, was that there was this recommendation to say that in light of, if there's very low community transmission, this risk of blood clots, this clotting disorder that occurs with AstraZeneca was a concern. But now that is totally outweighed by the high community transmission. So you've probably heard this quoted or talked about in the last sort of week or two, and to say that the best vaccine you can get is the ones that you can get into your arm at that time.
And just on vaccinations, so a lot of the questions, as you could expect, are around vaccinations. Greg from Warrington asks, if a person has contracted the virus and recovered, does it have the same effect as having had the vaccine? So effectively, do you have this immunity?
Yeah, so I heard Dr. Chant talk about it, or certainly in an article in the last sort of few days, is that that your immunity after getting the virus is not as good as what you would have with a vaccine. So there is still an encouragement that even if you've had COVID, after an appropriate amount of time, you should still get the vaccine. Okay.
And I've just got a question here from Louise. Which vaccine is being offered to this 12 to 15-year-old?
Yeah, so the 12 and 15-year-old group is the Pfizer.
Okay, thank you. We've got a question here around, again, around the patients, the demands of COVID, and having to isolate them in the hospital. Can you just sort of still getting those questions through? So you've got people in the hospital with other conditions, just how that works, I guess, from a practical sense of how you isolate patients away.
Yeah, okay. So at the moment, and I talked a little bit earlier about how the hospital is really sort of pivoting and changing all the time as we get more patients coming through. So it's in a really sort of detailed plan that's well coordinated through all the managers and the executive, and also on the advice of our clinicians. Those who know Nepean Hospital, if they've been unfortunate enough to sort of need to go to the hospital for any reason, will know that we've got this sort of ward or this tower called West Block, and that's the building that you see, that's the curve curved building that you see as you drive down Parker Street. And on that particular building, we started off with one ward being the dedicated COVID ward, and the other wards were not. And then as we got more patients successively, each subsequent ward became COVID wards. So those who don't have COVID, we isolate over, or we keep them over in East Block, which is the newer building across from the mental health building. So there's this constant assessment of an evaluation, because once a ward, for instance, is labelled or is determined to be a COVID ward, the staff who work in there have to wear PPE, and all the processes are different. Where previously you might have said, oh, look, I'm going to the surgical ward, or I'm going to the medical ward, or I'm going to oncology. It's now been rearranged in a way that to clearly identify COVID wards in order to ensure as much as possible that we have, clearly identified COVID, so that everyone's clear about what they need, what precautions they need to put on. And so I think, there's been some really great initiatives of the hospital to minimise staff movement around the hospital, for instance. So you'll have medical and nursing teams who are designated to just that ward, and they're not sort of walking through the hospital. We've limited, if I was to speak about the intensive care, for instance, we normally have two pods, or we call them pods of 12 beds, and what we've done is we've opened up a third pod, so now we have an extra 10 beds available, and we've essentially stopped the flow of staff and patients through. So there's very distinct ways that you move, and that's a really important strategy as part of the health response, where there are very clear areas where you enter what you call a red zone, and then there's the amber zone, which is where you might have patients who are suspected of having COVID, and then you have what is the green zone, and they're the patients who don't have COVID. So you can imagine logistically how complicated that might be, but it's really important.
It's something you've been doing for a long time. You've been planning for it, and you're ready for it, which I guess is what the community is asking, that things are in place to make them feel safe. Yeah,
sorry, Melissa. Yeah, I think one, plans that have been in place, but I think more importantly, sometimes plans on a piece of paper sound good, but then when you go to enact them, it didn't quite work as well as you thought it would. And I think that's what's been great about our health system is and particularly our staff at Nepean, is we've been able to have these conversations and get feedback from everyone to say, we thought that would work, but that didn't. So how about let's try something else? And that's, and I think that is really a good reflection of the culture at the hospital and our collective desire to serve the community is the best way that we can.
Okay. Before I jump onto a few other questions, I'll stick to vaccinations and address, I guess, what you see on social media around alternative sort of treatments for COVID, or alternative treatments instead of vaccinations. Could you address some of this, folks? A lot of people have asked me about this.
Sure. How interesting the times are, in relation to the instant availability of information. Okay, I think there's no doubt there are so many, pros to that. The fact that we can have, we've gone to now my 15 months of being on Zoom meetings, for instance, and we've our work life and our home life and the way that we've been able to adapt has been totally different. I think there is a downside, though, to social media, is that some things can come through and it's totally unvetted, okay? And it's really difficult to navigate what is real and what is not, and what is evidence-based and what is not. So even when you go to something that you think, and you click on the next link and you think, oh, look, there's this little evidence to this, whatever alternative treatment it is, or whatever treatment it is, and you'll read that on face value and say there is evidence for it. But I think that what we need to be mindful of and careful to, as a community, to really anchor on is we have world-class evidence-based medicine. Okay, our structure, that is the culture of Australian medicine and Australian healthcare, that we have regulatory bodies, we constantly monitor adverse events. We look at international evidence. Our clinicians, our nurses and doctors really look at whatever trials and information that's coming from abroad. And on that basis, there are very clear recommendations from peak bodies. And that then, for me, the messaging is that have confidence that the systems we have in place for health, which really is which critique evidence and ensure that the treatments we are recommending are of benefit and definitely outweigh harm and risk, that recommendation that's official on a health website or by Kerry, Dr. Chand as the Chief Health Officer, or your GP and the clinicians who are looking after you, you can take that as being the evidence and the best care. Do we have uncertainty sometimes between two equivalent things that have been approved? Sometimes we might disagree. Two clinicians say, oh, one or the other, but they're all approved medicines. I think that's the most important message, that if they've been approved through the Australian health system, which is a very regulated, safe body, like a structure, then that's what we should trust.
I think that's a really, really good message. Thank you. I've got a question around, and you've talked a bit about treatment in hospital, but there's people with COVID are in their homes as well. So we've got a few questions here around what treatment. Lauren from Penrith, for example, asked what treatment is recommended to positive cases while they're isolating at home to prevent them from needing to go to hospital.
Mm-hmm. So I think one of the one of the ways that the hospital has been able to really respond well and to minimise patients needing to come into hospital is having a very clear group of patients who we can keep a monitor on by a medical and nursing team who ring patients at home 2 times a day, 3 times a day if needed. Some of them are assessed as being a bit higher risk, and they have pulse oximeters or how to check oxygen levels at home, and they're asked to write them down in a diary. So our hospital and the home team, led by Dr. James Branley and some really skilled nurses and doctors have really ramped up and finessed the ability to really fine-tune those who can stay in the community and give them triggers to say, if you have these things occur, or if they phone them and they're worried, then there's instructions to come to hospital. So that's allowed us to look after 600 patients who have COVID in the community and not have them come to the hospital.
Thank you. A question around, and it's a question, it's really natural, we all have that. What do you think the future looks like with living with COVID and how we manage that from a health perspective?
Yeah. So it's such a time of uncertainty at the moment. I think I sort of, in my roles, we're talking about this all the time with the knowledge of how do we best gear our system? How do we ensure that our nurses are sustained and because this is going to be what we talk about is the long tail. Okay, you've heard the Premier talk about the peak being October, and that's a long time to sustain, I guess, the energy for to care for the community. So we're really mindful of that. And I think as a system or across the state, we're really mindful of and I said this at the press conference, that, at the backbone of our health system are our nurses. And they're the ones at the front line spending those 8 and 10, 12-hour shifts with the patients in full PPE. So we're really mindful of fatigue. We've had some, and it sounds really, it sort of sounds like, that it shouldn't have such an impact. But I've seen Facebook posts of our nursing staff having, hampers delivered and messages on Facebook to thank them and thank the staff. I think all those sort of things really rally the staff. And it is, we sort of, there's no doubt there are days where we're down, but it's really important that we rally and say, this is what we worked for, we trained for, and this is our job, and this is us serving the community. How are we going to live with COVID? I think that at when we have a really high vaccination rate, 70, 80%, 90%, and hopefully we could be one of those communities with an even higher vaccination rate, is that COVID will be around. And at some point, it won't be Delta, it'll be the next version of COVID. Okay, so I think we have to recognize that the reality of that's going to occur. And then we have to build the system and think out of this, we may be able to get that really clear message of resourcing our future health and medical and nursing workforce and our whole hospital structure in a way that allows us to not only deal with the impact of a surge like COVID, but then to continue and catch up on all that activity and surgery that I know many of the community have had to postpone. We want to be able to catch that up. We want to be able to do that. So I think the system, the health system as a whole, is going to need to really build up and recognise that we will need to have that foundation in order to ensure that those who were impacted by COVID because surgery was delayed, for instance, elective surgery was delayed, that they get treatment in appropriate time. Because although we talk about not elective surgery, that surgery is still required. And those patients who don't have had it cancelled are still living with pain or chronic pain and waiting for procedures. So we're really mindful of that as well, that we can't forget that. We can't let go of the fact that in order to serve the community, we're going to have to really ramp up all our resources. And how fortunate are we that out of this, at the other side of this particular peak, we're going to have this brand new hospital to move into, which hopefully we won't have any problems filling, because we'll be able to hopefully do catch up on the surgeries and other things that we wanted to do or need to do on the basis of so much being put off.
I think that's a really good message, and it's a question that a few people have come to me about in this, is around when can we return to life as we knew it, the Australia that we love and miss. And you said, return to those important elective surgeries, with people in pain and other conditions, and we'll have that beautiful new revamped part of the hospital, that new addition. I think that's a really important message, is that we are working towards getting back to all those things. So, 70%, 80% vaccination, kids going back to school as well, businesses going back. These are all really important things for our community, for us to return to somewhat normal, that we're all really looking forward to. I have a question for you, and it's something I know has come up a bit around the people finding out when they've been in close contact, or actually getting their results for being COVID positive. So I had Paul from South Penrith asking, when a person is tested positive after a swab test, are they allowed to roam free? We know they're not, but do they stay home and quarantine for 14 days? Is there someone checking on them? And so a bit about what people need to do. And if they haven't heard from anyone, still, there are still public health orders for people to follow, I guess.
Yeah, that's right. So look, how the landscape has changed. If you think about, if everyone remembers back to, let's say Avalon, okay, that cluster before Christmas, and I remember days where there was this sort of request to say, can we get to 40,000 tests a day? Can we get there? Can we get there? And I remember there was a bit of a mini celebration. We got to 70,000 tests. 8 months down the track, we're now at 120,000 tests a day. All right. So I think that is really testament to the community still recognize the importance of testing if they have symptoms. What that does mean, though, is there's a particular strain on testing. Okay, so the actual tests being able to be done by the laboratories, both public and private. There is then when there are positive cases, there's I guess the extra number of patients that the community, the public health teams have to phone. There's no doubt that that's not as efficient as was when we were only seeing 100 patients positive a day. All right. So when we're at this, there is a limit. But what the health system has done is tried to do things like be really clear about the public health messaging in multiple languages, which is important because there are cultural considerations. And the second thing is in the way that they message through texts and so forth. I think it's very clear, from a public health sort of point of view, and I hope that everyone knows that a positive test, even if it has been a day later than you think it should have occurred, it's come. If it's positive, then the message is very clear. You need to isolate for the 14 days. It'd be nice if someone phoned and checked in on you, and hopefully at some point, in that's a timely sort of phone call. On the other side, we would hope the community and the messages being so clear that if you're worried, then you seek help. There are phone lines that are set up. You can reach out to your GP, and obviously there's always the emergency department if you've got worsening symptoms.
Thank you. I've got, we're almost out of time. So if you have any last minute questions, please put them into the comments, although there's a lot coming through, and unfortunately we won't get to all of them tonight, but I will endeavour to answer any that come to my office. So please do email me, and if there's any that are from a health perspective, I'll be sure to pass them on to Dr. Nguyen. But I've got a question here from Pratibha, who was asking, it's a really relevant question around the time between a first dose and a second dose. So there's been some changes in the recommendation, and does it matter? The answer would, I imagine, is follow the doctor's advice when you have it, but there's around the 12 weeks to 8 weeks with AstraZeneca in particular.
So I can totally understand how it feels so confusing, these changes, all right? And I think the key messaging probably is it's a good reflection of the fact that the system is providing advice in response to what is going on. Okay, and I guess that's the messaging, is that in the ideal world, when we have plenty of vaccines and no COVID, the international studies have shown 3 weeks between doses for Pfizer and 12 weeks between doses for AstraZeneca. Okay, ideal world, and this is in overseas. But when we're faced with not enough supply and rising cases, we have to balance that a little bit. So what do? We think, okay, it's really important to at least get a first dose in, right? So let's get the first dose in of Pfizer and then stretch out the time a little bit. We know that the second dose of AstraZeneca provides more, like the best protection if we can get the second dose in. What can we reasonably pull that back to ensure that you get protected a little bit with the first, but let's not wait 3 months to get potentially the best that you can. It's that sort of idea that balancing it with those, if we cut it back to 8, you'll still get good protection. It may not have been quite as good, but in the meantime, there's all this COVID, that's circulating the community. I think that it's not that the evidence is changing. It's actually a response to a pragmatic or a practical solution or a practical decision in order to get the most people protected in whatever way they can by getting at least the first dose of a vaccine in.
Thank you. I'm going to jump in and ask a question. And it is around what we can do as a community to help our frontline workers and our doctors and nurses that are working so hard to keep everyone safe.
Yeah. So you've seen many impassioned pleas by our staff to really sort of call out to the community. And the call out is that we can do this, we can do this to, we'll be there to support you. We'll be there to look after you if you need to come to hospital. But the best thing that the community can do to help the staff and to help the hospitals and our whole community is to get vaccinated. Okay, and I think that it can't be simpler than that. And we understand that it's frustrating that you might book and there might be sort of some trouble with booking in, but keep trying, and we'll try and do what we can in order to go to your GP. There are many vaccination centres which do have vaccines available, and there are various strategies of walk-in centres and so forth. I don't think I can emphasise enough how important that is. The public health orders, as difficult as they are, it's one other part of the vaccine sort of public health, and that the whole system, in all those steps become important. So it's important the hospital end, the community component of looking after patients who need us, but the choice that the community can make in getting a vaccine when they can is the best thing they can do, because then we can sort of see from a health point of view a light at the end of the tunnel, is that as the numbers, we can rally and do this, and we'll absolutely, our staff are dedicated to doing that. But I can't, I really, have to be honest that it's tiring. Right, it is tiring, and it's difficult for our staff. As I said, they also have families. They've got children. They've got parents. They're all, and this is not the life that we want. We're a community that likes to be able to go outdoors, and that's why we live in the Penrith area. And to have that restriction is really hard on everybody. So I think that's the best thing that the community can do to help us, is to follow the public health orders while they're there, because they're there for a reason, in order to minimise spread, and get vaccinated when they can.
Well, I think we couldn't have heard it from a more expert and on the ground and frontline person than you, Dr. Nguyen, that message around the importance of getting vaccinated, and as tough as it is following the health orders, and we can't wait to get out of this lockdown. But it's such an important message on behalf of our community to say thank you to the work that you do in intensive care at Nepean Hospital, looking after people, particularly right now with COVID and all, and to Dr. Branley and his team in infectious diseases as well, and all the staff there at the hospital. You are doing such a remarkable job, and it is a 24/7 a job caring for people. Thank you so much, and thank you for taking the time out to share your message and answer a few of the questions. There's so many, they're still coming through that people have in our community. I'm really grateful for that. I'm sure people that are out there are grateful for your time as well. Thank you. And thank you to everyone in our community for jumping on. I thought it was really important for us to be able to get that first-hand insight into what's going on in regards to the local health response to COVID. So please do continue to look after each other. There is a coronavirus hotline number. If you need it, I'll read it out. It's 1-800-020-080. And if you need anything from me, my office is still open. You can get me on email or through the phone. But thank you for joining us this evening, and thank you so very much, Dr. Nguyen.
Thanks very much, everybody. Stay safe. Thank you.
Thank you.